So very good evening to all with the viewers of Proctology channel at Patanjali Yogi Haridwar. This is Dr. Sachin Gupta again with a presentation of a very complex case of that is scrotorectal perianal transsphincter fistula. It is basically it is a horseshoe fistula basically. This is a very clear fistulogram. You can clearly see these are two views. That is, one is interior and another one is the posterior view. And in interior view, you can also clearly see the catheter is passed from the external opening, that is from the external, that is the scrotal opening. Then it enters into the cavity. You can see this is another one track, and this track attains the shape of horseshoe manner. This is a scrotal opening of this, or this is a testicular opening. And whereas in this this is lateral view, you can clearly see. This is the scrotal view. You can see this is the opening which is on the testis, that is on the right testis. And you can see the extension of track. This track extended from right side of the testis through the perineum, that it is very nearer to the median raphe. Then it enters into the anal canal somewhat here. And this is another opening of another track which lies at 2 o'clock, approximately 5 centimeters from the anal verge. And this track also crosses both the sphincter, that is internal as well as external sphincter. And this is the anal canal. This is the anal canal. This is the anorectal junction. And above there is a rectum. You can see the shape of the rectum somewhat here. And this is the sacral bone, and it is the presacral area. So it is a very complex case of fistula. In this session around 6 months, this is the most difficult case what I am going to operate today. Very important in this case is, number one is, first of all, the laser, especially in the median, near the median raphe, the tract which is very much nearer to this urethra. What happens when we give huge energy, that is at the level of 10 watts or 12 watts. Sometimes what happens, there may be the injury to the urethra because the tract which is very much near, I will show you in this urethrogram, especially that is RGU, You can see this is the urethrogram, and again this is the, you can see this is the testicular opening. And this track is very much curvilinear. You can see this, and this is the urethra. It is very much nearer to the urethra. What happens when we give laser ablations? When we give the laser energy nearby this area, sometime there may be the friability of the tissues which is very much nearer to the urethra, and it may sometime injure it. And there is a leakage of urine inwards. That is near the urethra, and which enters into the scrotum sometime. So important in this, or the tricky, the approach is very important. First, I'll deal with the help of Troppis technique. Number one, I'll just excise the internal foci of the disease. Number one. Number two is, I just give a laser ablation from testicular opening towards the opening which enters into the anal canal at a very low voltage, nearby the 3 or 4 watts. Number two. Number three is the track which is at 1 o'clock. Again, in that track I will also go through that laser and do the curettage and do the laser ablation again. When both the tracks are open from both the sides, and finally I do the marsupialization of that Troppis area. What happens, and again then I will do the corings of upper tracts, and it will shorten the time of the therapy and minimal injury towards the sphincter. So this is again Dr. Sachin.